So my name is Dr. Grant Pagdin, and my specialty is anti-aging and regenerative medicine. A number of people find their physical activities to be curtailed by degenerative arthritis and chronic sports injuries and things like that. So in terms of trying to find some evidence to support the field of regenerative medicine, it's an area in the medical literature that is really exploding right now. There's tons of interest. It actually started in the dentistry field more than 15 years ago. And they were using extracts of blood, like platelet-rich plasma, to help bone grafts in the jaw and help to increase the purchase for dental implants and this kind of thing. Then it made its way into orthopedic medicine and plastic surgery in the mid-2000s, so since about 2000 to 2005. And so there are increasing volumes of papers and research and interest coming through in the medical literature now, so that this field is really an area that's beginning to explode. Because it's been around for almost a decade now in traditional medicine, we are seeing some papers now that are showing evidence of 10 years of follow-up. Patients that have been treated, say, in 2005, now followed up 10 years later. So there's really some good stuff emerging in the medical literature. These procedures that I perform are still considered to be experimental, however. So when a patient comes to see me for an initial consultation, they're interested in knowing how exactly do we perform these procedures and what kinds of risks would they face. So there would be 3 procedures in the full stem cell package that a patient would come in for, and each of these procedures takes approximately an hour. The first one is to draw some blood to obtain platelet-rich plasma. We need about 2 ounces of blood. We prepare it in a special container, we spin it in a centrifuge, and it automatically decants off the red blood cells, the platelet-poor plasma, and we are left with a platelet-rich fraction. We get about 10 cc's of platelet-rich plasma after this process. The second procedure is trying to obtain some stem cells from fat. So the typical place where we would try to get some fat is back in the love handle area here, and most people have a little bit of fat there. Oftentimes patients will say to me, could you take a little more? and we don't need a ton of fat. We need about 30 cc's of fat. So the way we obtain that is we inject some freezing through a little hole that we poke in your flank. We inject some freezing, and then we have a small little catheter that we insert that sucks out a little bit of fat. So it's not really a full liposuction kind of procedure like you might have in the operating theater. We just call this lipoaspiration. So we're really just sucking out a small volume of fat through a tiny, tiny little hole. When we're done sucking out the fat, we just cover up the little hole with a steri strip and a sterile dressing. And you may expect a little bit of bruising in that area because we've been poking around. But there's certainly plenty of local anesthetic such that the procedure is not particularly painful. The third procedure then involves trying to harvest some stem cells out of your bone marrow. And people hear bone marrow and they think, oh my gosh, that's going to be really uncomfortable. I actually find in my experience that people find the aspirating of the fat to be a little bit more uncomfortable than aspirating the bone marrow, so it's not really that big a deal. We have the patient lying flat on their stomach, and we access the back of the pelvis. That's called the posterior iliac crest, so just off to one side. At the back of the hip area, top of the buttock, is the crest of the pelvis. We put some freezing into the surface of the bone, and with a tiny little trocar, we poke a hole, and we suck out about 2 ounces of bone marrow. So it's not a huge volume that we need. We pull the trocar out, and again, where that area will be covered with a sterile dressing. Then the bone marrow is prepared in the same way that we prepared the platelets. It goes into a special container, it goes into the centrifuge, and it spins down, and we purify out the stem cells. So I'll end up with 3 vials sitting on my tray for my procedure. I'll have a vial of platelet-rich plasma, I'll have a vial of fat, and I'll have a vial of bone marrow. So then we prepare the joint that we're going to inject. So suppose it was a person with a knee with osteoarthritis. We would prepare the knee with some sterile solution. We would cover it with a sterile drape. We would put a little bit of local anesthetic in the skin. Then we introduce a needle into the joint. That needle stays in the joint. The nurse hands me first the fat. I put in the fat. Then she hands me the bone marrow. I put that in there. Then she hands me the platelet-rich plasma, and I put that in there. We pull the needle out, put a little sterile dressing on, good to go. We do have all of the things in our body that we need to heal up the joint. The problem, of course, with a joint with osteoarthritis is there really isn't a good way to get all those growth factors in there. There's very little blood supply inside the joint. The center portion of the cartilage of the joint really has very little blood supply. So although your body has good intentions of trying to heal itself, arthritis is unfortunately one of these degenerative conditions. Once it gets a foothold, it's going to gradually spiral downwards. That's why your orthopedic surgeon will say, come back and see me in 5 years and you'll need a new knee. He can tell, looking at the x-rays, where you are now. He knows where you're going to be in 5 or 10 years.